Greetings, friends. Peace be with you. My name is Denislam Shakitanov and I do hijama. Today's lesson will be devoted to incisions. The incisions are the most basic thing in hijama. Hijama is an ancient procedure, capillary bloodletting. It is the same method of treatment, which treated a huge number of people in vast areas of the earth. And this method is great for getting rid of a huge number of diseases and helps in the recovery of the human body. Surely you have seen a huge number of athletes who have seen the marks from the cans on their backs or other parts of the body. This is exactly what hijama is. A huge number of athletes, MMA fighters, boxers, a huge number of wrestlers and representatives of other sports do hijama in order to recover very quickly from injuries, or to get a procedure before competitions, in order to improve their results many times over. I can't tell you all about hijama in one lesson, but today's lesson will be devoted to the incisions, because most people who find out about hijamas are afraid of the incisions most of all. They think it's scary, they think it's painful, and that keeps them away from hijamas. Now you will see that this is not the case. You will see that the incisions are very easy and not at all difficult, not at all painful. And so, let's begin our lesson. So how does a hijama start? The hijama begins, of course, with the preparation of the instruments, so that everything is available, that everything is prepared, to be clean, and that it is all workable. So let's see. What tools are used for hijama? Hijama is bloodletting with the help of jars. It is a very ancient procedure, which was done with different tools. And today we have great medical plastic jars, the vacuum in which is created by a special pump. You don't need a fire to do it. Next, in order for the hijama to be most effective, we use a jar massage. We oil the patient's body with black cumin oil, which has a cure for all ills, and use a special jar. This causes a very strong rush of blood to the skin and relaxes the muscles. In the treatment we use hydrogen peroxide, and we use antiseptic solutions to disinfect the skin and the instruments. We also use cotton pads which you can buy in any store, and special wipes which can also be purchased there. In order to avoid the scarring of the incisions, we use a variety of remedies. And one of them is Kist al-Hindi, a powder. How to use it, we tell about it in detail in our courses. In order to remove blood from the jar, we use special tools. This is a funnel. It's made from a plastic bottle, from the neck. And there is a measuring cup with divisions, which you can use to control the amount of blood that comes out during the procedure. And one of the most important elements of the procedure is to choose the right cutting tool. Is the blade. A huge number of blades are available, but not all are suitable for hijamas. And we've chosen the best ones. The very best brands, there are several. And you can buy these online. They cut through the skin beautifully, they're subtle and they don't leave deep marks. And we ask you to use them exactly, in order to achieve great results. Now we are going to talk about the technique of notching and some of the mistakes that are made in this process. We strongly recommend to our students in our course to practice notching and hand placement on fruit, namely on bananas. Half blades are used. These are the blades you need to find on the internet. They are already divided into halves. The blade must be taken not so, but like this, at the very tip. And you work with 2 fingers, very flexibly and very gently. You need practice so that you can adjust the length and depth of the cuts. When you put your hand in the right position, you can feel how deep you cut through the skin, and you will be able to adjust the angle and depth of the incisions. Now I will show you how to make the right cuts, which are as painless as possible and do not leave deep marks. Important, we put the ring finger of the cutting hand on the surface, on the body or on the surface of the fruit and begin to make cuts. The notches are small. The length is somewhere around 3 or 4 or 5 millimeters. Later, these notches will get darker and you will be able to see them. When you have a lot of experience, you can make the notches like this. But in the beginning you should not chase the speed. The speed will come with experience. These 2 rows of incisions are optimal in both depth and length. That is, these incisions will heal rather quickly and will not be traumatic for your patient. One of the most common mistakes is not putting your hand on the body. So these fingers here, the ring finger and the middle finger, we strongly recommend that you put it on the body, so the hand doesn't wiggle. If your hand is in the air, you risk getting scars that may not heal for a long time. This brings discomfort to your patient. When the arm is unsupported and the incisions are made as follows. We get incisions with different depths and different lengths. And this can be very uncomfortable for the patient. These 3 rows of incisions are optimal to ensure maximum blood output and not to leave deep scars. The lowest row of incisions is made in a chopping manner. When the incisions are too deep, they leave marks and cause discomfort to the patient. The most common mistake made by many beginners is to make 2 small incisions which do not fully penetrate the epidermis. The small incisions basically look like this. They are not even incisions, but dots. You can check it yourself. When you put cups, after applying such incisions, only 1 out of 10 incisions will give blood in sufficient quantity. The rest will just give half a drop of blood, and the effect of such procedure will be minimal. But there are situations when the application of both small and deep cuts is justified. Moreover, sometimes it is necessary to do it. About it you will learn at our course. I will now show you how the incision should be positioned in relation to the circle from the cup. Some incisions don't bleed when applied incorrectly, so they have an obstacle. There are places where you have to make the most incisions, because it is from these places that the most blood comes out. The cup is removed in the following way. With these fingers we hold the body itself, and with the index finger we lift the valve. We let all the air out. We let the air in. And then we disinfect. And then we do the incisions. Now I'm going to show you the places that need to be emphasized. These are the places that give off the most blood. The place is the center of the circle from the cup. This is where you have to make the incisions. Very close together. The spaces between the rows should be minimal. The incisions should not be made close to the edge of the cup, because they will not work. The cup will interfere with the blood output. Now I will show you how to make the correct incisions. Do not go for speed. It comes with experience. Be sure to stretch the skin with your fingers for the cuts to be most effective. This video is for introductory purposes only. Knowing how to make incisions and knowing the atlas of the points does not make you a specialist. To avoid harming patients, we strongly recommend that you take our courses, where the pathogenesis of diseases and methods of treatment of specific diseases will be explained in detail. After taking our course, you will have the support and help of specialists, with whom you can consult at any time.